medical mental gym. We'll discuss one of the GIT conditions, of which is known as gastritis. Okay, so health is the key to success. That is the motto for medical mental gym. So let's get into gastritis. So before we begin talking about what gastritis is and what causes gastritis, we'll briefly look at the an overview of the anatomy of the stomach. So the stomach consists of the lower esophagus. So before we reach the stomach, we have the lower esophagus, then we have the cardiac sphincter, then we have the fundus of the stomach, as well as the body, the greater curvature as well. Then we also have the less curvature. Then we have the pyloric antrum region over here. Then we have the pyloric sphincter just over there. Then we have the duodenum. Then we can look at some fibrous tissue or the muscle fibers of the stomach wall. So we'll begin with the innermost fiber of the stomach wall. So the innermost fiber of the stomach wall has the oblique fibers. Then we have the middle fibers, which consists of the secular fibers. Then we have the external fibers consisting of the longitudinal fibers. Then we can also briefly look at the surface epithelium of the gastric pit, which is consisting of some mucosa neck cells, as well as the parietal and the chief cells over here. Yes. So just simply what the parietal and the chief cell does is that the chief cells are responsible for producing some digestive enzymes, as well as pepsin. Then the parietal cells are responsible for the production of hydrochloric acid. So let's get into gastritis. So what is gastritis? So gastritis is just simply inflammation of the stomach. So the stomach mucosa can be inflamed, it can be irritated, or even erode due to gastropathy. So there are certain terms such as pangastritis, antrogastritis that are used to describe different types of gastritis. So like pangastritis, it is affecting the whole stomach. Then we have the antrogastritis, which is only affecting the pyloric antrum region. Yes. So gastritis can be broadly divided into acute gastritis and chronic gastritis. So we'll begin with looking at acute gastritis. So there are many severity levels of gastritis. An acute hemorrhagic gastritis is the most serious type of gastritis. The stomach surface epithelium is exposed. What happens during gastritis is that the stomach surface of the surface epithelium of the gastric pit is exposed to gastric juice. Henceforth, the cells will absorb hydrogen ions, and this will increase the internal acidity, and this will interfere with the metabolic function of the stomach because of what is taking place, and this will lead to an inflammatory response. Then we look at chronic gastritis, which is known to be gradual or due to persistence of a prolonged ongoing gastritis infection. So there are three types of chronic gastritis, where we have type A, which is the autoimmune gastritis, type B, bacteria induced gastritis, and the type C, which is the chemical induced gastritis. So we can look at the autoimmune gastritis. So the sickness progression in this way, or the sickness progresses in this way. So the mucosal membrane may experience destructive inflammatory changes such that on the surface and progress to impair its entire thickness, including the stomach glands. So when this stage is attained, hydrochloric acid, intrinsic factor, as well as some digestive enzyme output are all significantly decreased. The intrinsic factor secreted by the stomach parietal cells serves as an antigen, and intrinsic factor is, we also need to take note that intrinsic factor is also important for the absorption of vitamin B12. So the inflammation will go away when the cells of the gastric pit are killed as a result of this aberrant immunological disease. So although the underlying reason for autoimmune gastritis is unknown, there is just an hereditary factor and a correlation with thyrotoxicosis, chronic thyroiditis, and adrenal atrophy to play a role in the autoimmune gastritis. Then we can also look at which is the type B, bacteria-induced gastritis. The bacteria-induced gastritis is well recognized that Helicobacter pylori is linked to the gastrointestinal disorder, particularly chronic gastritis and peptic ulcer disease. Despite gastric lesions developing later on in life, some antibodies to microorganisms such as H. pylori will begin to develop in an early adulthood stage. Yes. So we move to chemical induced gastritis as well. In addition to being frequently brought on by endogenous chemicals like bile and pancreatic secretion chemicals, or reactive gastritis can also be brought on by exogenous unpleasant substances, including acetylcyclic acid, which is aspirin, which is a non-steroidal anti-inflammatory drug. Then chemotherapy and alcohol can also lead to the production or the secretion of some chemicals such as gastric juice and pancreatic secretions. So there's been some similar histological features, which includes capillary damage, epithelial damage, and it will extend up to erosions. Subsequently, regenerative hyperplasia will take place. Then there will be edema, there will be bleeding, and the smooth muscles will undergo proliferation. But it's said to believe that some authors have suggested the word gastropathy rather than the term chemical or reactive gastritis, as suggested by the new Sydney classification, since cellular infiltrates are minor or absent. Yes, so others don't call chemical induced gastritis as chemical induced gastritis. According to the new Sydney classification, it can also be termed as a gastropathy. Yes. Then we move to the etiology of gastritis. So what causes gastritis? So we've briefly talked about what can cause gastritis. We've talked about bacterial infections consisting of H. pylori. Then we've also talked of the non-steroidal anti-inflammatory drugs. So just to add something on the non-steroidal anti-inflammatory drugs. So usually what happens is that these drugs inhibit the cyclooxygenase 1 enzyme and the cyclooxygenase 2. Henceforth, there will be no enough production of prostaglandins. And I'm sure we all know that prostaglandin is responsible for the production of mucus. So if someone is a chronic user of non-steroidal anti-inflammatory drugs, they are prone, or they are at high risk of having gastritis, because the non-steroidal anti-inflammatory drugs are causing inhibition of the production of prostaglandins, which will lead to reduced production of mucus in the gastric pit, and henceforth this can lead to inflammation. Then the autoimmune has been talked about already. Then the bowel reflux disease can also cause gastritis. Then stress as well. Stress can cause gastritis because it can lead to massive production of hydrochloric acid in the GIT tract, as well as alcohol and radiation chemotherapy. I'm sure some of these things have been talked about when we were talking about chronic gastritis. Then we can look at the signs and symptoms. Someone would present with bloating, bleaching, anorexia, vomiting, some hiccups, and the most common one is the abdominal pain and the burning, often in the upper center of the epigastric region. These are some of the signs and symptoms that we can elicit during the diagnosis of gastritis. Then severe gastritis can lead to life-threatening symptoms, which can be a severe chest pain. Someone can feel like fainting or short of breath, severe abdominal pains, sudden onset of bloody stool. The blood may be red or tarry in texture, vomiting blood or black material resembling coffee. So when someone has started producing blood, this can be an indication to show that there's perforation going on somewhere else. So this can even lead to anemia, and someone can go into shock due to the bleeding that is taking place. So if someone comes bleeding with a history of gastritis, it can be a perforated ulcer, or it can just be an eroded gastric lining. So we need to look at that very thoroughly. Yeah. Then we also have what is referred to as melena, which is the black stool that people come with. Then we also have the hematemesis, which is the vomiting of the blood in medical terms. So how can we diagnose gastritis? So on the basis of medical history and physical examination of the patient, we can diagnose gastritis. It's mostly clinical, but we can also do other testings just to be definitive with our diagnosis. But the diagnosis of gastritis is a clinical diagnosis, so you need to have a thorough history and a good physical examination. So under diagnostic tests, we can do imaging tests and supportive tests. So imaging tests can help us make a definitive diagnosis. So we can have upper GIT endoscopy, and we can also do the upper GIT X-ray. Even though an X-ray is included because it can show some free air in the abdomen there. Then we can do supportive tests such as full blood count, urine tests, and we can do stool microscopy, culturing, and sensitivity. Then for the treatment, how do we treat gastritis? So antacids will frequently relieve some symptoms. So it is recommended that we administer them when symptoms arise, or only when there are anticipated mostly we can anticipate the symptoms to take place during the meals or during the sleep. So we can take these medications in between meals and before going to bed. So we can take magnesium trisilicate, which is a chewable compound. We can take 250 to 500 milligrams whenever necessary. Or an alternative can be aluminum hydroxide, which is also chewable. But the best would be removing the offending cause. So we eradicate the offending cause by using a regime that is known as triple therapy, which can be a 1-week regime depending on the severity of the condition. So we can prescribe amoxicillin 500 milligrams TDS plus metronidazole 400 milligrams TDS plus omeprazole 20 milligrams or 20 milligrams twice daily, or we can be giving 40 milligrams once daily in a course period of 1 week, which is 7 days. Or an alternative can be, we can give clarithromycin. An alternative of triple therapy, we can give clarithromycin 500 mg twice daily with metronidazole 400 milligrams twice daily, or tinidazole. Then we also add omeprazole 20 milligrams daily or 40 milligrams once daily. And we come to the end of the presentation. Thank you very much for your attention, everyone, and I hope you learned 1 or 2 things out of this. Please like and subscribe to our channel for more videos like this, which is medical mental gym. Always remember that health is the key to success. Thank you.